Hello everybody, this is Dr. Zhang from Roselle Center for Healing. I hope everyone is doing very well right now. So today I will talk about the Hashimoto disease. Hashimoto is one of thyroid problems. Last year I talked about the thyroid problems, not only Hashimoto but all the thyroid. But there are too much information there, so we just this year we just only talk about the Hashimoto disease. So Hashimoto disease, is thyroid problems. But before we talk about the topic, I want to ask you some questions. So the question is, do you have a dry skin or brittle nail, or dry or cracked heels? Do you have any numbness or tingling in the hands, or constipation, or abnormal menstrual cycle? If you do have some of these symptoms, you may possibly have thyroid problem. Okay, so thyroid problem, these are hypo and hyper. So just so we talked about a bit just now, Hashimoto is a hypothyroid issue. So then the other way is hyper. Today we will not talk about too much about it. We still mention some of hyperthyroid problem, but it's not a lot. But we focus on more hypo. So you see on the left side of the pictures, all the hypothyroid problems: arthritis, cold intolerance, or depression, dry skin, or gain weight easily, constipation, slow heartbeat. Okay, we'll talk about it more later on. So before we get there, because thyroid disease can affect more than what you think. So a lot of people say, okay, thyroid is only there, but however, it affects your whole body. Thyroid, just like your thermostat in your home. So probably some people have the problem with thermostat. Sometimes they know how painful is that. So that means you have to know, your body have to know how to adjust your temperature on time and in time. Same thing. Not only that, but also a thyroid problem can affect your liver, your intestinal tract, your heart, kidney, your brain. Because thyroid is a part of endocrine system. So think about that. If your endocrine system is not balanced, how can you balance the whole body? How can you feel better? So that all the organ, all the cells, they need a hormone to grow. They need a hormone to develop, right? Same thing. That's why later on I will mention a little bit about the thyroid problem in the kids and also the pregnant people. Okay. So talk about thyroid, you have to know how thyroid works. So thyroid work is not only by himself. Everybody probably heard about the TSH. TSH is a thyroid stimulating hormone, right? TSH. But actually TSH, where is formed? What is related to? What's that for? So a lot of people know, okay, my doctor give me a prescription, give me blood draw, let me test the TSH, can see my thyroid function. But however, is that right? Is that proper, or is any other more? Are there any more tests to evaluate the thyroid? Yes. Is that enough? No, it's not enough. It's definitely have more values to evaluate your thyroid, not only TSH, not only T4. So I will talk about this later on in the lab test. Okay, so I will tell you how we can evaluate the thyroid in comprehensive way. Okay, so speak of TSH, actually TSH from TRH. TRH from the brain. There's a part of the brain called hypothalamus. Hypothalamus is produce the TRH, then produce the TSH, then stimulate your thyroid to produce T3 and T4. Okay, and then they convert from T4 to T3 in liver. It's all this kind of loop. But since on the left side here, you can tell the hypothalamus stimulates the anterior pituitary, and then that can stimulate the adrenal cortex. So this is the green one is supposed to go this way. But however, if you have too much adrenal cortex or cortisol, and then go back to suppress the release of hormone from anterior pituitary, and it's even though the hypothalamus. That's what we call negative feedback. Okay, so that means that's why a lot of people have. That's why so many people have thyroid problem, because they're so stressed. They're so stressed. They're tremendous stress your kidney, and there's this nervous system called sympathetic nervous system, which is a fight or flight system. So that system let you keep attention all the time, keep you. It's a good thing you need some of them, but however, you do not want to over have them, because if you over have them, they suppress the body. Your body always in the very alert status. So that means you your adrenal keep popping up the cortisol, and then same thing can. The other way, a cortisol can affect your insulin level, insulin release. Then later on, they can cause insulin resistance, then cause the diabetes. Okay, so all this kind of information together can make the body sick. Okay, so this is the lobe. We have to make sure the hypothalamus, anterior pituitary, and adrenal cortex and connect very well, and then function very well. Okay. So that's why later on we'll talk about that. That's why chiropractic can affect your thyroid, because chiropractic can alter your brain function. Chiropractic adjustments is not only for pain relief. Most of the time, more important is it can alter your brain function, make your brain function better. If you make your brain function better, come back again, the hypothalamus is better, and then can get more hormone release, more stimulation, more TSH, more hormone release, then stimulate your thyroid function better. Okay, so they all connect each other. So same thing, if we want to treat some disease, not only thyroid problem, we also want to treat the cause. For example, stress, anxiety. So we don't want to just give you some anti-depression drugs, anti-anxiety drugs. It only can relieve the problem for a short while, but however, long term, it doesn't work. But same thing, you do not want to rely on the drugs anyway. Okay, it's not a different topic. Keep continue. So this is exactly how the hypothalamic and the pituitary and thyroid axis, how they work. By hypothalamus, and it goes TRAs and stimulate TSH from pituitary, pituitary, and then TSH stimulates the thyroid with T4, T3, and T4 goes to liver, and liver from T2 and T3 to the active form. It's in the liver, kidney, brain, and T4 is converted to T3. Okay, so R means the reverse T3 is an inactive byproduct. So we'll talk about later on about this meanings, or something definitely. RT3 is also part of lab test. All right, so the HPA and HPT axis is very complicated. It looks as if you're confused. Okay, don't be confused. So I will talk about more of that, and then you don't have to know this. I'll just let you know. We know better what's the mechanism behind this, and then we can treat you better. So you don't have to understand what we're here. So you will understand later on. Okay, so leave that part for me. I will leave the other part for you. Okay, all right. Going here is still shows you how it works, and also tell you some nutrition. What you need the nutrition to support the thyroid. So this is also my treatment plan. You need special nutrient for thyroid to grow and to the thyroid to release the T4 to what it's supposed to release. Okay, all right. So anyway, so all my today's lecture, I have 6 parts. So the part 1, I talk about the physiology or anatomy of thyroid gland. So that's easy for you to palpate, easy for you to detect before see the doctor what's going on with you. So that's why I always tell the patient, so the best doctor is yourself. It's not me, it's not somebody else, it's yourself. Your body is your body. You are your body's best doctor. Okay. So part 2, I will talk about the thyroid function test to see which tests we can do for fully reevaluate and evaluate the thyroid. So part 3, we talk about Hashimoto disease, how it happened, why it is so popular, why it's so popular, why it's so harmful for the body, how the Hashimoto can affect you, what is underlying reason cause Hashimoto, which is the most important. So we want to know the reason, we want to know the cause about Hashimoto disease. Okay, so the part 4 is the other common thyroid disease. So, it's just a few of them. So I don't want to talk too much because today is only focused on Hashimoto's. Okay, so part 5, we cover the treatment, how we can treat the approach of Hashimoto disease from a holistic way. Speaking of holistic way, this is very interesting thing. So yesterday I had a patient, this new patient, he has a lot of different issues. We talk about holistic. The patient said, okay, I like holistic so much. I said, why? How what kind of experience make you see this? He said, okay, before I had a Crohn, you see, he just put mask down. I do my put mask down, it's fine. I said, work with it's fine. I wear a mask anyway. I put a mask down, he says, I can't see my teeth, it's a Crohn. Okay, then put a mask back. And so my teeth are all Crohn, and I feel so much better because, but however, before this Crohn, the other dentist put the Crown there, but it's all metal. So I feel terrible. I feel horrible. I feel, I don't feel that. I don't digest very well. I don't do very well in my digestion. But turn out, I went to another holistic dentist. They said, okay, it's a heavy metal in your mouth. We have to change that to different material, which is not a heavy metal. So since I changed it to the other material, I don't have any issue about digestion. So you see, you can tell how holistic treatment is so important for the body. How they can harm you if you don't think the whole picture, or instead only see one part. So that means same thing here. When you see Hashimoto, you don't only see one part, you see a whole picture. Okay, so the last but not the least, I will tell about some tips you can bring home, you can do at home right now, especially right now. Probably some people work at home, it's great. So then you still can do something for your health, to do some exercise, right? Actually, the best doctor has to prescribe the 3 prescription. The first prescription is the treatment, how I treat you for me. The second the prescription is the exercise, how you can exercise properly, make sure you don't over-exercise that, and then to make your body stronger. The third one is nutrition. So everybody rely on the nutrition to survive anyway, right? So you have to make sure you take enough nutrient for the body, and the body can use that. So that's why you have to prescribe the nutrition, let patient know which part of nutrient you need, and then they can get a better health. Okay, so this is the best doctor actually in the standard is my philosophy, but it turns very, very, very good. So when I was in China as a doctor there, so I do this all the time. I did get a lot of results. Okay, good results. I mean. Okay, thyroid gland, stress. We talk about stress. Stress can stress adrenal release the cortisol. Cortisol suppress a lot of digestive enzyme release, suppress the all the gastric acid release, cause a lot of digestion problem, and cause insulin resistance, cause diabetes. But stress is the most common problem right now, especially this DC area. So the traffic stress, work stress, all this kind of stress from different area, different standpoint. Okay, so we have to if we Stress is definitely underlying reason, is a cause. The Hashimoto is one of the many causes of Hashimoto too. That's why we had to focus on, some people we are trying to find the cause. If you have stress, we have to reduce the stress and then to affect your Hashimoto. So anyways, that's just to let you know. So we have found the cause instead of treating the thyroid. Okay. All right. So this picture can tell you how stress affects your thyroid. Okay, suppress the immune system, suppress your thyroid hormone release, or slow down. If you slow down, and that's why a lot of people, stressed people, they feel so sluggish, they feel so slow. So that's the reason. Okay, so next, see here. Part 1, we talk about thyroid gland, where it will affect our thyroid function. So we still need to get treated. So you need to get some treatment or nutrition advice. The main hormone, thyroid hormone is T4. Okay, same thing is directly influence many body organs, the heart, the brain, or liver, kidney, and the skin. So that's why we talk about if you have dry skin, if it dry hairs, maybe it's thyroid problem too. Okay, all right. So that's why the same thing it can affect your metabolism. So body weight, that's why a lot of people said, okay, even I drink water, I still gain weight. So that means your water retention is very urgent, right? Urgent. So that means your body cannot metabolize the water and the calories out of the body. That means the metabolism rate is very slow. If your metabolism rate is very slow, so that means your body cannot detox yourself very well. Everybody knows how detox yourself is so important. So if you cannot detox yourself, it causes a lot of inflammation in the whole body and then cause a lot of problems. Okay, so metabolism rate. That's why a lot of people say, okay, I just cut off my carbs, cut off my protein, whatever. No, cut off my fat, but still gain weight. That's the reason. Okay, all right. So we talk about the thyroid is also your thermostat. So it can regulate your body temperature, and it can regulate the growth and the brain development. Especially brain development, especially for the kids, especially for the mom, for the pregnant people, and they affect the baby in the abdomen, the tummy, in body. Okay, it can definitely affect you see the central nervous system operation and the menstrual cycles. Okay, you see here during the infancy or during the infant and childhood, adequate thyroid hormone is very crucial for the brain development. Okay, so a lot of people just know the DHA or omega is very good for brain development, but however, they forget thyroid hormone. But it's not very common, but it does exist. It does exist. It does exist. Okay, I did see some child they have thyroid problem because they don't know. They say okay, brain dysfunction. Even though autism, all this kind of this kind of the problem, they can also be called thyroid problem too. Okay. So next, so how does thyroid function? So you say how does the thyroid gland function? So we talk about the major thyroid hormone is T4, is thyroxine. So them saying the T4 has to exact the effect. T4 has to convert to T3. T3 means try. 3 is try is 3, yes. So they had to convert to T3. So from T4 to T3, it mainly occurs in the liver and in the center, in the certain tissues, brain or function, but mainly in the liver. That is why stressed people have a hard time to convert T4 to T3. Because from Chinese medicine standpoint, liver is an emotion organ. If you have anger, stress, you stress your liver. A liver gets very congested, and then your liver is not functional. When I say liver is not functional, that means you saw okay, AST is high or LT is high. No, it doesn't. They don't have to be high to show the liver dysfunction. Okay, so that means all the numbers before they go to bed go to a very high number. The body will compensate you, so that means you will get compensation from the own body until that's when it blow out. So that's why I have a very popular lecture last year called Body Signals and Warning Signs. So you have to know the signals from the body can show you something, and then you notice that, and you jump in earlier and before it gets worse. Okay, so that's why. So liver. So we have to make sure liver get a very good function. It can convert to T4 to T3. Okay, if your liver is not functional, your thyroid function sounds like or feels like your thyroid is not functional, but however, the reason not thyroid, the reason is the liver. The reason is the liver. Okay. Okay, so same thing. The T4 produced is innervate the control about the TSH. TSH is made in the pituitary gland. It's located in the base of the brain. That is why, if you have upper cervical problems or misalignment, it's not very in the right place, it will affect your brain function. It will affect the pituitary gland. It will affect the TSH. That is why chiropractic also can alter thyroid function. Okay, all right. So we talk about the Hadron thermostat, some bloodstream, GFT4, and then can adjust the temperature in the whole body. And then pituitary, if they see the pituitary is very little, T4, and they produce more TSH, okay, keep going. Go. Tell the gland or thyroid to produce more T4, so vice versa. So you can turn on off definitely because they have the loop. They loop. Okay. Here a little bit, the picture there. But sometimes the low TSH, the high TSH is different based upon the other value too. Okay. So the most healthy individuals, a normal TSH value can show you, okay, your thyroid functioning okay, but it's the most healthy individuals. But however, it's not a lot of people, they only have thyroid problem, they also have a lot of issue underlying. All right, so T4 functions as storage hormones on its own. It's able to produce energy or deliver oxygen to cells. So you undergo a lot of before you get T3, they have to undergo the process as a monodialdeination. Okay, the T4 test is measured two values. The total T4, that's about total T4 is bound with the protein as they interfere with the ability to enter the certain tissue. So T4 bound to something and go to the tissue and work. Okay. Free T4 is not bound to antibody, not bound to protein as an active form of T4. So that means if you don't have enough free T4, and then you have enough T4 to bound to the protein. Okay? So we have to know the free T4 is very important too. Okay? Free T4 is a free T4 and hyperthyroidism can elevate a free T4 and a free T4 index. Okay, vice versa. Combine the TSH test and free T4, is more accurately to determine how the thyroid is functioning. T3 is the active thyroid hormone. Remember that. So we have to convert from T4 to T3 where liver. It determines severe hyperthyroid problems. So if the patients all have thyroid problem, hyperthyroid always have an elevate the T3 level. Yes, even though for hypothyroidism, it's not very common to test T3, but however, hyper can switch easily, go back and forth. Okay, yeah. So another one, pregnancy. We talk about pregnancy. If you take pregnancy, if you take birth control pills, the high level T4 and T3 can exist. This is because estrogen level increase in the level, the bonding proteins. Okay, so that means the estrogen. A lot of people have the estrogen dominant. So a lot of people use birth control pills before. A lot of people use makeups, all this kind of hormones. I'll tell you about later on how estrogen can affect your whole body. All right. T3, total T3. So there's 3 different tests measure T3. Actually, for total T3, free T3, and reverse T3. Total T3 is obviously the total amount of T3 that's circulating in the blood, both bound or unbound protein. So free T3 is bound to protein and considered the active form. Okay, so reverse T3 is the inactive form. It's mirror age of T3. So that means they're attached to thyroid ruptures, but it's not an active form. It's the reverse form. Next, a thyroid antibody test, which is very important for this, especially for Hashimoto. So I'll tell more. Hashimoto is autoimmune. So if you can see in antibody in the body is positive, and then you can confirm you have autoimmune or from blood. Off in the office, but because we all the blood tests it should be enough, but radioactive iodine uptake is different as an option for the people. But same thing in developed country, it's not a problem. Actually, in the U.S. or European or developed countries, not a big problem with iodine actually. But for most people. All right, so we talk about Hashimoto disease next. The Hashimoto. So Hashimoto's is actually they did research. Women are more likely than the men to have a thyroid issue. 1 in 8 women will develop thyroid problem during her lifetime. It's pretty big. It's a very big number. 1 in 8 women. This is a very big number actually. Okay. So same thing. It can definitely alter, change, or have problems in menstrual cycle. I do have some patients. They came to office. You know, these about 40s. They say, okay, menstrual cycle is awful, cramping, or it's not on time. You know, it just can sometimes last 2 weeks. Sometimes can skip months, but all the 40 is definitely not menopause. So that when check, they come into the same for acupuncture. So I say, you know what? So from Chinese medicine, because they heard from Chinese medicine is very good for, the Chinese medicine, the needles is very good for the female disease. And they just to me, I said, okay, I'm going to check that. So did you ever check your thyroid? He said, no, nobody told me to check thyroid. I went to different OBGYN. So they said, okay, thyroid is a hormone. It is going to check my estrogen or progesterone, but they didn't tell me thyroid. When I checked thyroid, it is awful. It's not very great. So that's the reason actually can change can give you a problem for menstrual cycle. Same thing you see here. They definitely can lead to early menopause before age. It means you get older. If you get early menopause, it makes you older easy. You get older. Everybody wants to stay younger as long as you can. Everybody, but you don't want to get too early at menopause. Okay. So we tried. So state here, hypothyroid. Hypothyroid. Hashimoto. We talk about Hashimoto is one of hypothyroid thyroid problems. But however, it the same. Dr. was asking me the question on the radio. It does the same with hypothyroidism and with Hashimoto. The answer is yes or no. Yes, because Hashimoto share some symptoms with hypothyroidism. But Hashimoto is autoimmune. So autoimmune, that means you also have some autoimmune symptoms too. So that means you also have a lot of different organs get evolved because of autoimmune. Which organ? So it depends which kind of autoimmune you get. Okay? That makes sense? Yes. Okay. All right. So autoimmune model is very common. So we say Hashimoto, we call it Hashimoto thyroiditis. Thyroiditis means inflammation. Inflammation means the body cannot detox yourself. You put your body too much junk food to your body, too much junk in the body. That's why we have to focus on how you eat. So later on we'll talk about that, how you eat better, how you eat well, how you eat properly. Okay, you eat organic food doesn't mean you can absorb that. That's we bring up another topic of food sensitivity. Okay, a lot of people know I have food allergy. I cannot touch peanut. I cannot touch this. I cannot touch this. However, this only shows you, for example, if you have allergy to peanut, they give you a lot of very bad reactions. Then your body know, okay, no, I cannot touch this. But however, there's still some other food can cause discomfort to your body, upset your body, cause inflammation. They do not cause that much damage, just like the food allergy. So that means this is not bad enough to cause food allergy, but still can cause inflammation in the body consistently if you don't know which one is that. Okay? So that's why we do the muscle test to test the food sensitivities and to let you know which food you have to avoid for a while after your body gets stronger, and then you can take that. Okay? So it says the thyroiditis can be caused by autoimmune type 1 diabetes, rheumatoid, Sjogren's, all these kind of autoimmune problems, genetics, the bacterial infections, and certain medicines can cause that problem too. And this is a very common thyroiditis, Hashimoto, and the postpartum. Okay, autoimmune is immunity problems. The 85% immunity in the gut. So that's why we focus on the gut to build up the immunity. Okay. So Hashimoto develop very slow. They can be over several years. That's why people came to see me. The complaint is from a couple years ago, a few years ago. I feel slowly get worse and worse. At first you just feel tired, you feel sluggish. You don't feel very energized. Sluggish, slow, and later on, more. There's all the symptoms: cold, constipation. It's all through heart rate, dry skin. Puffy nose. We don't talk about the loose lateral 1/3 eyebrow. It's very common for thyroid problem. Check now. If you have lateral eyebrow loose a lot, you lost that, or it's looser than before, you have to suspect your thyroid function. Okay. So the puffy face, especially in the morning, especially puffy underneath the eye. Okay, small liver, kidney, adrenal. Okay. Then I want to talk about this one, less sweating and then uro. Some people come here and say, okay, I don't sweat. So, no matter how I do, no matter how much work I do, no matter how much exercise I do, I don't sweat. They don't know there's a reason, because if your thyroid is problem, you don't sweat too, neither. So, they just say, okay, because my body type it's not body type, it's your thyroid problems. And also, hypothyroid, Hashimoto is hypothyroid. So, that means the metabolism rate is very slow. If your metabolism rate is very slow, your cholesterol will be very slow to be digested. You can stuck there for a bad extra cholesterol. As the LDL get high, you get high cholesterol, it can raise your heart rate, heart disease. Okay, all these symptoms is Hashimoto symptoms. Plus, you have Hashimoto. Hashimoto, the autoimmune. You have some autoimmune symptoms. It depends which one you get autoimmune. Okay, so talk about thyroid. We talk about the halides. Halides are so common right now in the water, in their vegetables, in their pesticides, in all this kind of the citrus flavored drinks, nasal sprays, inhalers, swimming pools, hot tubs. All these have their halides. Why hair loss so important? Why is the hair loss so bad for the body? Because you see here, they prevent the thyroid receptors being able to collect iodine. Iodine is very, very crucial for thyroid hormone producing. Okay, highlight is so popular right now, so common right now. That's also another reason why Hashimoto's, why thyroid problems get so much increase right now. Okay, so that means that's why we always recommend people to eat organic food as much as you can, to eat a very clean food without pesticides, to eat some food. If you eat some the meat, try to eat the grass fed or free range, because if you don't grass fed, if it's a lot of hormones there, they can grow faster. But however, you still eat hormones anyway. Indirect estrogen. So estrogen people, how estrogen can affect thyroid function? That's very new actually. So a lot of people don't know if you have estrogen dominant in the body, it can definitely affect your thyroid function. So in 2011, the peer review studies means it's a very thorough study from a lot of cases. So the researchers examined the rule how the estrogen levels can affect the thyroid. So it's how the estrogen level affects the thyroid receptors. Okay, so they found that estrogen levels might affect thyroid functions and lead to thyroid disorders. So that's why the test thyroid disorders can help. If you're treating the thyroid disorders, can help manage the menopause symptoms. Okay. So part four, we talk about the common thyroid disease. Let me say how to build up immunity. Immunity is your arsenal. Is a barrier. Is your wall. You build up a wall to prevent you get affected from a virus, from bacteria, even from corona. That's why some people, their immunity is so strong that even though they carry the virus, but they don't show the symptoms. Okay. All right, so they begin slowly still. They can weight loss, easy weight loss. They cannot get weight easily. This is the opposite. Hyper is opposite hypo. Okay, so change your eyes, bulging in the eyes, the redness, or get angry easily, it's irritation. And also there's another point I want to share is it's very easy to get osteoporosis. It affects your bone and can affect your calcium absorption, right? So on top of this is about this postpartum the thyroiditis affects the 10% of people after pregnancy. It's not very common, but still 10% is a good number, Okay, same thing, they often goes undiagnosed because symptoms are most like the baby blues. Okay, they don't touch the thyroid, but you have to be careful. If you have some friends, if you listen to my lecture right now, the friends or your family relatives, just if you have this kind of blue baby symptoms, you have to be careful, be very tired and moody. You test the thyroid problem too. Okay, so test the thyroid. Goiter is an you're enlarged the thyroid gland. You definitely see it's remember at the beginning I said you are not supposed to feel the size of the thyroid. If you feel the size, something's wrong there. Okay. Common causes Hashimoto causes thyroid because remember talk about the hyper and hypo can switch each other if you don't switch back and forth, if you don't treat it very well. Then grave thyroid nodules, thyroiditis, thyroid cancer. Thyroid nodule. So nodule, that means the cancer. So nodule is mostly benign. Actually, thyroid tumor, most thyroid tumor is benign. Okay, nodule is swelling in one section. The thyroid gland, you can see here swelling is fluid or blood. Why? you want to ask why was the reason called the fluid in there is because the inflammation, because you didn't take your right food, cause the toxins stick there. So that means we have to detox the patient. All right. So same thing we talk about. The most do not cause symptoms, but you just can feel something wrong there. Just sometimes you can feel a little bit hard to swallow. Because nodule there is more tension pressure, but it's not cancerous. Okay, some nodules may take too much hormone test or too much thyroid hormone may make too much. It can cause hyper problem too. Sometimes you feel nodules yourself. You can, if your bump moves up and down when you swallow, it may be thyroid nodule. So we talk about when you swallow, you definitely can feel it go up and down. If if the bump is not going down, it's stuck there, it's not good. Treatments include the watch and waiting to see what's going on there, and surgery to stick it out. Thyroid disease can affect pregnancy. Pregnancy is very important to affect the pregnancy, and it definitely can affect that. Okay. It's affect the baby development, happy moms, the nutrition intake, all this kind of organ, give a lot of pressure on the kidney, and give a lot of pressure on the liver. It's not very good for control the temperature, making mom so moody. All right, so for the baby children, so all the children, so they have to do screen test. Somebody do screen test and don't. So if you have the thyroid problems, the girls is very slow growth and cranial problem too. So all this can developmental. Okay, part 5 treatment. So same thing, we want to treat the cause. The Hashimoto is autoimmune. Autoimmune is a lot of different reasons cause autoimmune. It's not only because thyroid function, but different things can cause their problems. So autoimmune, we have to treat immunity. It's a bunch different way can build up your immunity. Okay, so we have to make sure immunity gets strong. So we do not, if you have autoimmune, so we do not to suppress. You're not supposed to autoimmune. You should, that's another word called a balance. You have to balance your immune system instead of autoimmune. Okay. Also, by the way, most people know autoimmune means your body attack yourself. Your body not only attack the bacteria, virus, not only attack your bacteria and the virus, but also attack yourself, which is not a good thing. It's kind of autoimmune. So same thing to the cause. Remember, talk about how chiropractic affected the nerve, how the nerve, different nerve comes from different segmental and goes to different area, and definitely can affect different organs, thyroid, brainstem, and acupuncture based upon their energy flow. So that's why Chinese medicine think the body is survive because the energy flow there. Acupuncture can alter the flow, the energy flow to affect the thyroid function. It works very well because it's been 1,000 years. When I was in China, it's a very successful way is acupuncture to balance the hormone, balance the thyroid function, balance the immunity, build up immunity. Nutrition. So all the thyroid, thyroid, the hormones need a nutrition, need a specific nutrition to build up, to produce. Okay. So when we talk nutrition, then we talk about supplements. A lot of people have, they don't. Some people do have balanced diet, but some people do not. So that means you have to have the balanced diet to get nutrients. If you don't, we have some supplements to, in short while, you need the supplement to fulfill your plan, your diet plan, to supplemental, but you still cannot replace your food. Okay. All right. So one, we talk about the tape. So I always tell you guys different tapes, different lectures. Today we talk about the food reflexology. So we don't do here. But we do most time in outdated in China. So it works very well, but it's not very often. But it definitely can work very well. Okay, there is the part that's called this thyroid part. It's just right here. Is it here? Thyroid. Is the both spade. Thyroid. Is it the toe? Is the bottom of the feet? It's the toe, and this area thyroid. So I will, no matter it's a hypo or hyper, as long as your the thyroid function is not very good, you want to massage this area every single day, about 5 minutes every day. How? You can clockwise 1 minute or 2.5 minutes or half time, and counterclockwise. Please do not do one direction. You want to do clockwise and counterclockwise. Okay, do both. So do 5 times a day. So as the long term, if you don't have any thyroid problem, it's totally fine. So you can improve your thyroid function. Always good to get better. If you do, you definitely feel better benefit from there. Okay. All right. So it's all I talk today is to keep healthy, do no harm. It's all I tell the patient. It will show in every my lecture. That means you have to have very good immunity to prevent getting sick. Okay. Prevention is always good than compared to treating. Okay. All right. So thank you very much for listening to my lecture. But I think we'll get back next month on our face-to-face lecture. We will try to do the best to follow CDC guidelines to in the house. So I wish I do this lecture in the house because guys can ask your questions. I know you guys will probably have a lot of questions. But if you have any questions, let me know. You can call the office, and then I can call you. You can email me too. My email is a website. You can go to a website, can email directly to me. I can email you back. I can answer I can call you back. So just a different way to reach me. So okay. So same thing. Last one. So we did this lecture. If you think you have more questions, you want to sit down with me to leave a consultation, do leave an evaluation about your autoimmune problem, do a little evaluation about your thyroid function, the hormone function, not balance with me for, I'm also I'm chiropractic and also acupuncturist too. I'm holding 2 licenses. So either one, if you want to talk to a different one, I can definitely very happy to sit down with you to talk about your health, to make your health better, to make you enjoy the well-being better. Okay. So same thing. Generally, if we do evaluation, if you don't throw this lecture, it's about $225. If you throw this lecture, we do the promotion is $99. It's only available. If you call the office, tell the front desk, okay, I came from Dr. Zhang's the lecture, so which is supposed to $99. But this $99 is not goes to everybody, it goes to charity. Charity is to care for others. This is for 401c3. It's Virginia approved. It's tax deductible actually. So caring for others. So same thing. Every year we do a lot of charity for shelter, different shelters. Do the baby in their shelters, whatever the case. So yeah, so if you have any questions, any concerns, do you still want to let me evaluate your health, not only thyroid, but also the other health issue, blood pressure, or the stress, emotion. I'm be happy to sit down with you to talk about your health. Okay, so I hope this pandemic situation, I hope everybody build up your immunity, everybody stay healthy, everybody enjoy life. It's in good weather. You don't have to wear mask in public areas. So I wear mask in the house all the time. I mean, in the office, in the inside, but you do not need to wear the mask in the outside. You want to get more natural vitamin D from the sunshine. You want more fresh air. Your body needs fresh air. If you don't have enough fresh air, so the body cannot metabolize very well neither. You cannot detox yourself. If you don't get enough, the oxygen, from outside body, your hemoglobin is not working very well, can carry oxygen to different part of the organ, they work better. Okay, in other words, stay healthy, keep healthy, do no harm. Okay, so if you don't know just go to my website, to email me, call me anytime. All right, so I'll see you guys soon. Bye, good luck, and stay healthy.